All right, today, Avid Sports Medicine, we're going to focus on spinal CARs, or controlled articular rotations, for the upper and lower back, but not necessarily the cervical spine or the neck area. So what we're going to do is we're going to stay in this tall kneeling position, a pad underneath your knees. Then we're going to cross our arms over our chest. We're going to give ourselves a nice little hug, okay? So active engagement of your arms and shoulders. Your abdomen will kick in, so very important to make sure that the hips stay in this neutral position. Eventually you're going to want to bend at the hips where you're sitting back, but we don't want to do that. We want to move just from the mid-spine and lumbar spine. So in order to make sure that doesn't happen, we are going to put this yoga block between her feet, and I'm going to tell her to squeeze that yoga block. You can see her glutes engage as well. So now we're going to get into the motion. So we're going to tuck our chin to our chest. We're going to give us a nice little tight squeeze. We're going to round forward without moving the hips. So she wants to push her hips forward. That's what she's going to think about, so that all the rounding is now coming. That flexion is coming from the back. And then she's going to rotate to one side. Then she's going to side bend towards her hip. And then she's going to continue that rotation while maintaining her hip stability, tucked chin, rotating over to the other side, and then she's going to rotate forward into that rounded or flexed posture. We're going to complete 4 reps in each direction. So I'm going to have her turn and rotate. So she's now facing you, so you can see the amount of flexion and extension I want you to have. So again, tight glutes, squeeze the block, hold tight through your abs. You're increasing the intensity as you move into that rotation. So now she's rotating to the right, then she's going to side bend towards that right hip, and then she's going to work her way slowly into that extension, and then what she's really good at, and she's going to rotate over to the other side with that side bend, and she's going to use her abs and her obliques to pull her forward. And this is a very, very active movement. The whole time she's continuing to squeeze the block, her glutes, and maintain a nice stable position, accessing just her spine.